Yeah, magandang hapon po to everyone. I'm very proud to be part of this third batch. I've been lecturing from since the first, now third. Congratulations to Ship. No? So let me just set up my screen there. And I'm here to talk about the clinical course of HIV. All right. Can you all see
Yep, we can see it.
just my slides, no? Okay.
Yes.
All right, so let's begin. So Dr. Jello already covered the first few slides that I'm going to talk about, and this is mainly HIV transmission. Kasi when we talk about clinical course, you start with how you get it. No? So just by way of a review, when HIV is transmitted through sex, through blood products, transfusion, meaning mother to child, tsaka occupational. No? So pag sexual intercourse, there's heterosexual, there's MSM, there's oral sex in very, very small numbers. And then, of course, you can get HIV through transfusion, but like Dr. Jello said, very, very low rates na, or almost zero rates of transfusion-related transmission. And then needle sharing as well will belong under blood products. Mother to child, if the mom is infected, no, tapos hindi nagpagamot. And then occupational exposure, like nurses who can get stuck, but like was mentioned earlier, halos wala na rin na ganong cases. In terms of risk for exposure, number one pa rin is blood transfusion if we don't screen our blood very well. Why? Because it's direct to the vein. It's direct to the system. So 9,250 ang risk per 10,000 exposures. But following that would be receptive anal intercourse. The other thing that I want to point out is for sexual transmission, the risk increases as if there is a genital ulcer involved. No? So if there is herpes simplex or syphilis or whatnot, if there's an ulcer in the genitals, the risk for transmission increases as well. Now, when we talk about clinical course, I need you to understand two things, no? CD4 white blood cells and HIV viral load. Now, Dr. Jello presented us with a very good sort of life cycle of HIV, no? And he showed you yung CD4 na life cycle, okay? And I want us to think about CD4 cells as yung sundalo ng katawan natin. No? These are white blood cells. So these cells protect us from infections. No? And when we lose them, then we also lose our protection. The other thing is viral load. So CD4 cells, as the disease progresses, as HIV progresses over time, bumababa yan. Kasi we lose them, they get killed by the virus. No? And then, ang viral load, it's the measurement of the virus in the system, in the blood. So, as we expected, at the very beginning, without treatment, mataas na mataas ang viral load. But depende pa rin syempre on the stage of disease. No? And then, as we get the patient on treatment, the viral load will decrease. So this has been shown to you, but what I want to point out here is that diba, ang HIV, it binds to the CD4 cell, and there are many kinds of CD4 positive cells. And once the HIV infects the cell, HIV transforms the cell into a factory for more viruses. So it produces a lot more viruses, and then it eventually burns that factory once it goes away. No, ito yung kaya nasisira yung CD4, and that's how patients with HIV lose the CD4 cells. So when we talk about natural history of HIV and pathophysiology, the curve that I'm about to show you is on a patient who has never had treatment. No, yung curve is the next slide. And we will talk about three distinct stages. We're going to talk about acute HIV, and then we're going to talk about chronic HIV or clinical latency, and then AIDS, no, advanced HIV or acquired immunodeficiency syndrome. All right, so ito yung curve na sinasabi ko. So if a patient gets infected with HIV and does not get treatment at all, then this is the expected clinical course that he will take. No? You will see two lines, two curves. They're a violet curve representing the CD4 positive cells, which you can see is going down, and then a green line, a green curve representing RNA copies or the viral load. Okay, and you can see that it's trending up. Okay, so just to orient you in the graph, this side here is the CD4 T lymphocyte, and we are following the purple curve here. And then on the other side, on your right side of the screen, there's a viral load or HIV RNA, green line. And so ito yung scale na ginagamit yan. And then on the x-axis, you find weeks and then years. All right? So what can we tell from the graph? Basically, we expect that death, according to this graph, death occurs at around the 10-year mark, according to the study by Dr. Pantaleo published in the New England Journal. Sabi dito, 10 years daw bago mamatay ang isang pasyente with HIV. We have something to say about that later on. Now, let's talk, ano yung sabi natin? We had 3 clinical stages. So let's talk about the first stage, which is acute HIV syndrome. No? So let's just focus on this part. Once a patient gets infected with HIV, so ito primary infection, syempre, mataas pa yung CD4 count niya kasi kakahawa niya lang yan. So there are a lot of CD4s in the system. And then the virus starts at 0 and then rapidly, very rapidly replicates. No? So there's a very high replication rate of the virus with wide dissemination of the virus and seeding of the lymphoid organ. So that's what happens with acute HIV. Masyadong mataas yung viral load dahil hindi pa kilala ni immune system si HIV. No? And then the CD4 count also rapidly drops to about 500. Eventually, the immune system of the body is able to catch up. It's able to sort of temporarily control the infection. So nakikita nyo na arrest yung pag-drop ng CD4 count. The virus also rapidly drops in its replication rate. Okay? So yan yung nangyayari sa acute HIV syndrome or acute retroviral syndrome. It is known as primary HIV infection, and it occurs 3 to 6 weeks after HIV infection. It most commonly presents as non-specific flu-like illness. No? Symptoms are caused by the body's natural response to HIV infection. Kasi initially, kaya ng katawan or at least the body attempts to sort of clamp down on the infection. This table on your right shows you the clinical findings associated with acute HIV. So very, very non-specific. No? Fever, sore throat, some lymph nodes, general lymphadenopathy. So pwede sa leeg, pwede sa inguinal area or sa axilla, sa kilikili. You can also have a headache or retroorbital pain, arthralgias, lethargy or malaise, anorexia, nausea, vomiting. In more severe cases, you can get neurologic symptoms such as meningitis, encephalitis, and then you can also get a rash. So a lot of other diseases can actually manifest this way. And sometimes, or in a lot of times, the diagnosis of HIV is missed, especially if we do not have a high enough index of suspicion. Okay? So 3 to 6 weeks after the infection, acute HIV infection or acute retroviral syndrome. We said, diba, there's a very high viral load, so plasma viremia, wide dissemination of the virus, and then which leads to acute syndrome. And then there's an immune response to the HIV leading to clinical latency. Ito yung rapid drop in the viral load and the arrest of the descent of the CD4 count sa graph. Okay? So, let's talk about the next. All right, so it's something important lang. During acute retroviral syndrome, large amounts of the virus are being produced. If you remember the itsura ng graph, kasing taas ito nung near death, no? So large amounts of the virus are being produced in the body. HIV uses CD4 positive cells to replicate and destroys them in the process. So patients in this stage are very highly contagious. And at the end of the acute stage, the CD4 count slightly recovers because of the natural response of the immune system. Okay? All right. Next, what's our next? Sabi natin, clinical latency. So, na-arrest yung pag-replicate ng virus. And so, in the clinical latency, basically, you see that the viral load has somewhat dropped. And then the rate of the rise is not very high, not very steep, no? Tapos, yung CD4 count, pababa siya, pero hindi rin very rapid yung drop. Not like this part, no? Very steep slope, okay? So, ano ba yung clinical latency? Clinical latency is that stage where HIV is living in the person but does not produce any symptoms. No, it's also called asymptomatic HIV infection. Viral replication continues at very low levels, and the patients in clinical latency can still transmit the virus to others. Kasi syempre, nagre-replicate pa rin yung virus, it's present in the blood. And according to Western textbooks, like we pointed out earlier on, clinical latency lasts, on average, about 10 years. All right. And then we have the last stage, which is advanced HIV na. So after a period of several years, we enter that phase where suddenly the viral load or the viruses replicate very rapidly and the CD4 count rapidly drops. No? And this is really what's called advanced HIV. Now, if you notice, a lot of our patients start becoming sexually active. For example, at say age 15. So they start to have sex at age 15. And then they start to get sick with AIDS. At what age? 18, 19, 20, no? So we don't, in our setting, we don't really see the 10-year latency period that this graph is being talked about, that this graph is talking about. And we think that part of the reason is because of the kind of strain that our country has. Yung CRFAE, it's medyo technical, but based on some data coming out of PGH, no, and some other places, the strain of the virus that's circulating in the Philippines seems to be acting very fast and can produce end-stage HIV or advanced HIV in about 3 to 5 years. No? I don't know if there's a really good study that establishes this fact, pero this is what we see in the clinic. No? They don't really last 10 years. Kasi ang mga pasyente natin with PCP, bata. And when did they start becoming active? 3, 5 years ago. No? So that's an important point to remember. Hindi siya totoo sa atin, itong 10-year clinical latency. All right, so advanced HIV is acquired immunodeficiency syndrome, and the immune system at this point is badly damaged by the virus, and the patient becomes vulnerable to opportunistic infections. Without treatment, people with AIDS typically survive about 3 years if walang opportunistic infection. So once the patient hits 200 na CD4 count, pag walang OI, they will typically die within 3 years. But the life expectancy with an OI drastically drops to about 1 year in patients with opportunistic infections. So that's very important to remember. All right. So there are 2 ways to classify HIV. One is by the CDC and one is by the WHO. What you will use in your clinics, or what you should be using, is the WHO, because that's what also the that's what the DOH also uses. But let me just point out to you this important table here from the CDC, from Morbidity Mortality Weekly Review. Um, in the CDC classification, advanced HIV is stage 3, and stage 3 is heralded by a CD4 count less than 200 and a percentage of 14%. If you will look at CD4 reports, no, there's an absolute number and a percentage, because CD4 is a kind of white blood cell. So ang reporting niyan, meron siyang relative to the entire CD4 count population. Ay, entire WBC count, no? Kaya may percentage. But ang important sa atin, at least in the very beginning, is also the absolute value, because the absolute value will let us, or give to us, an idea kung kailangan ba startan ng mga prophylactic medicines, etc., etc. Okay? You'll learn about that in the next lecture. So AIDS, or advanced HIV, is a CD4 of 200 and below, and a percentage of 14% and below. Okay? Now, I just want to quickly run through the WHO clinical stages. And I think there's a question in your pre-test about this. The WHO clinical stage 1, asymptomatic infection yan. Patients can have just generalized lymphadenopathy. They feel very well, but they can also have acute retroviral syndrome. So yung flu-like illness, so yung mononucleosis-like illness that we talked about earlier, fever, sore throat, lymphadenopathy, and very non-specific symptoms. Patients go into clinical stage 2 when they start having unintentional weight loss. But I highlighted the medyo common ones that we will see in our clinics. Herpes zoster is an important hallmark. It's important for you to remember about HIV if you have a patient who presents with shingles and bata pa siya. No? Marami ako na-diagnose na pasyente sa clinic, ang presentation, shingles lang. Tapos 20-year-old. Masyadong maaga para magka-shingles. So herpes zoster should lead you to think about HIV. Patients can also get recurrent upper respiratory tract infections. And then for clinical stage 3, you can have chronic diarrhea, prolonged fever, oral candidiasis. No? Oral candidiasis, so thrush is stage 3. Ang TB, well, sa WHO kasama ang TB, pero ang Pilipinas, it's a different animal kasi dito napaka-common ng TB, so patients can get TB without HIV. So medyo mahirap siyang isama sa classification. And then severe bacterial infections. Now, for clinical stage 4, and I guess this is one of the important things we really need to remember, kasi dito na yung dangerous na opportunistic infections. So wasting syndrome, PCP, which is one of the most common presenting signs and symptoms of HIV, is when the patient is short of breath, exertional shortness of breath, tapos may lagnat, no? So PCP, toxoplasmosis of the brain, cryptosporidiosis. So a lot of patients will present with chronic diarrhea. Pag nagpa-AFB smear, modified AFB smear kayo ng stool, you can see parasites, no? Cryptosporidium or isospora. Cryptococcosis or cryptococcal meningitis is also part of clinical stage 4. CMV retinitis or cytomegalovirus, so patients who present with blurring of vision. Herpes simplex infection of mucocutaneous. PML, progressive multifocal leukoencephalopathy. Any invasive fungal infection, you should suspect HIV. And then candidiasis of the esophagus, trachea, bronchi, and lung. So anong difference? Ang clinical stage 3, oral thrush lang, bibig lang. Pag bumaba na si Candida sa esophagus, sa trachea, sa bronchi, or sa lungs, stage 4 na yon, clinical stage 4. And then the others, no? NTM or non-tuberculous mycobacteria, Salmonella septicemia, extrapulmonary TB, lymphoma, Kaposi sarcoma, and HIV encephalopathy. And then there's a correlation between CD4 counts and organisms, no? So, like I said, TB sa Pilipinas, not really a good marker for HIV, but all TB patients need to be screened for HIV. But for PCP, for example, PCP, cryptosporidium, pwede mo nang tansyahin na ang CD4 count niyan less than 200. Pag toxo, usually, ang CD4 niyan less than 100 na. And then pag may may CMV retinitis yan, or cryptococcal meningitis, or MAC, less than 50 ang CD4 count. No? So, that's really the end of my lecture. Just to quickly summarize, sexual transmission is the most common way to spread HIV. And we've already pointed out that the most common sexual route is men who have sex with men, no? MSM. CD4 cells, they're a measure of a person's immune status. So the lower the CD4 count, the more immunocompromised the patient is. HIV viral load, it's a completely different number, a completely different measure, and it measures the number of viral copies, or how much HIV is in the system. And then eventually later on, someone will talk about pagiging undetectable. And then we already also talked about the stages of HIV: acute retroviral syndrome, clinical latency, and advanced HIV.